Fecal calprotectin is a protein that is excreted by the bowel when it's inflamed. So it's a poo test, and you're looking for inflammation in the bowel. It's not very specific at all. So anything causing inflammation in anywhere in the GI tract can give you an elevated fecal calprotectin. So the two best clinical uses for it is for the exclusion of inflammatory bowel disease in the otherwise fit and young patient. So it's a really good negative prognostic indicator. So the classic patient would be the 25-year-old. They are usually ladies with on and off right iliac fossa pain, not particularly unwell. You're worried about Crohn's, but your other differential would be irritable bowel syndrome. If the fecal calprotectin is negative or in normal range and there are no other risk factors, you would be completely justified in saying, okay, it's irritable bowel syndrome, let's talk about your symptoms and let's see how we can help you. If it's mildly elevated, that can be due to reflux disease. Again, there can be a bit of inflammation associated with diverticular disease, and it can be Crohn's or colitis. But its main role, once it's elevated, you're sort of obliged to investigate, but it's not always a useful test at that stage. And then the other thing that we use it for is the gastroenterologists use it as a tracker for how successful their treatment for inflammatory bowel disease is. So if someone had Crohn's or colitis, when the disease is active, you'd expect the Calpro to be 700 to 1,000, or even higher. And if you're then giving them medication and that comes down, that's a good indicator that the disease activity is going down. So in terms of referral on the 2-week rule colorectal cancer pathway, it's not particularly helpful. But if there are young, otherwise fit patients where you're thinking query IBD, query IBS, if the fecal calprotectin is normal in those patients and there are no other worrying symptoms, you can quite happily sit in primary care saying this is irritable bowel syndrome. Let's look at your lifestyle measures.